So thank you for asking me to do this presentation today. Just a little bit of an introduction about me. I'm a professor in clinical decision making at the University of Manchester. I'm a registered nurse by background, and the work I'm going to present today is some work that I've been involved with some colleagues in the United States at Columbia University School of Nursing and the Visiting Nurse Service of New York and their Centre for Home Care Policy and Research, where I used to work. And given the current situation we find ourselves in terms of the COVID-19 epidemic, I felt that some of the work we've been doing looking at infection prevention and control amongst home care nurses, so that's the community care nurses out in the United States, might be of relevance to people in Europe. So I'm going to talk a little bit about the study that we've conducted and some of the results, and then I'm more than happy to answer any questions that anybody may have that's listening. So to begin, the reason that we conducted this study in the first place is that internationally, the number of people who are receiving care at home is increasing. And obviously this study was carried out in the United States, and the most recent data we have about the number of Americans receiving home care is around 4.5 million, and there's over 12,000 home care agencies in the US. And in the UK, where I'm now based, about 100 million contacts a year occur in community health services, and it actually accounts for about a fifth of the NHS budget. And those people who are providing care in the home are predominantly nurses, although it's not exclusively a nursing intervention service. Predominantly professional care providers are nurses, so we're interested in home care nurses or community care nurses and their infection control strategies. Now, the reason we're interested in infections, and as I said, this study was conducted before the COVID-19 epidemic, but actually infections that a patient acquires when they're receiving healthcare are often considered to be preventable with good hand hygiene procedures and good infection control procedures. And a study that was conducted by one of my colleagues in the US, Dr. Shang, found that about 18% of patients who were receiving community home care in the USA were actually admitted to hospital with an infection. So it's a big cause of unplanned hospital admissions, and it's a big concern. We want to try and prevent those infections from happening. Unlike in hospital settings, we actually have a lack of data on the risk of infections for patients and care workers in non-hospital settings. And we conducted a review of the evidence for the prevalence of infections in people who are receiving care at home a few years ago. And actually one of the biggest problems with this is actually defining who has an infection. But even with those issues, there's estimations that between 5 and up to 12% of all home care patients have some form of healthcare acquired infection. And as I've already highlighted, some of those may be severe enough for them to end up in hospital. So when we started this study, there was a significant gap in our understanding of what infection control looks like in home care settings and how home care nurses manage patients at increased risk of infection. So we wanted to try and understand how patients at high risk of infection are identified, and something to do with the decisions that nurses take about how to implement infection control interventions in a community home care setting. The research programme that we've been conducting over the last 5 years has had two main aims. The first one is to assess current infection control practices in home health care and compare them with guidelines and recommendations. And the second one was to develop and test a predictive risk model to try and identify patients at high risk of infection in a home health care agency. Now, because of limitations of time in my presentation today, I'm actually only going to present some of the findings of our programme of work, and I'm going to focus on the survey questionnaire that we conducted with 359 home care nurses, and the results of some interviews that we conducted with 50 home care nurses. We have also carried out quite extensive observation of infection control practices in home care settings, and another strand of the work has been to develop a predictive risk model using administrative data on over 100,000 patients to try and identify patients at high risk of infection. And I can certainly provide information about those elements of the study that I'm not presenting today to individuals who are interested after the presentation. Just to give you a little bit of insight into where the study was conducted. It's conducted at the Visiting Nurse Service of New York, which is one of the largest home care agencies in the United States. It was established in 1893 by a lady called Lillian Ward, and every year it serves over 100,000 patients across the New York metropolitan area. So that's Manhattan and the outlying boroughs of New York. And all of the research that I'm talking about today was approved by the Visiting Nurse Service of New York and Columbia University Ethical Review Boards. So firstly, I wanted to talk to you about the survey that we conducted. And the aim of this was to look at home care nurses' levels of knowledge of infection control practices, their attitudes towards infection control, and their self-reported behaviours and compliance with infection control interventions. It was an online questionnaire which we adapted from a number of existing tools. And before we administered it to the 2 home care agencies who participated in the full survey, we piloted it with nurses from 2 agencies who are independent of our final sample. The 2 home care agencies that participated covered both urban and suburban areas of New Jersey and New York states. And they actually have quite a different demographic in terms of both the patients they serve and the nurses who work for them. This is just an overview of the conceptual model that we use to inform the survey design, and it feeds off an ecological approach to trying to explain behaviour, which suggests that characteristics like age, sex, gender and education may influence people's knowledge and attitudes towards infection control, and also whether or not they comply with infection control practices, and also the theory of planned behaviour, which suggests that knowledge and attitudes towards infection control practices may also impact on compliance with infection control practices. In terms of the survey, the nurses who responded to the survey, overall, as I said, we had 359 nurses who responded across the 2 agencies. Overall, they were predominantly female, and that's an issue for the whole of the nursing profession, and that's characteristic. They're quite ethnically diverse, 43% non-Hispanic white, 24% non-Hispanic black, and 11% Hispanic or 22% other mixed race or ethnicity. And 72% had a bachelor's degree or higher. They're also quite an experienced workforce in home care in the United States, with an average length of years in nursing of 22 years. So they're very experienced nurses. I'm not going to go into the survey results in great detail, but this is to just give you an overview of the main findings from the survey. So each element of the survey had a different number of questions associated with it. So we then changed those into proportionate responses. So on this scale, 1 is completely 100% appropriate attitude responses, and 0 is none. And as you can see, that actually overall they self-reported quite highly on compliant practices with infection control, quite highly on knowledge about infection control practices, and also positive attitudes towards infection control and infections in home care. These are just examples of some of the questions that we asked in the survey with their proportion of correct or appropriate responses. So as an example, we asked in one of the knowledge questions, masks or goggles are necessary when care is unlikely to cause splashing of fluids. Now, that is an example of a question where you would disagree with that if that was a correct knowledge response, and about 70% of our sample gave a correct response to that. And then another knowledge question was standard precautions apply to all patients. The appropriate response to that is yes, and over 90% of our respondents agreed to that. In terms of attitudes, infections are a serious problem in home care. Around 67% of our respondents thought that that was an issue, and an attitude towards hand hygiene in terms of protecting patients from infection, that was nearly 100% response rate. And then compliance, self-reported behaviours. I wear goggles or an eye shield when I may be exposed to bodily discharge or fluid. That was around 70%. But hand hygiene procedures before and after patient care, almost 100%. So you can see there's some variation in the knowledge, attitudes and compliance responses from the people who responded to our surveys, as well as the overall attitudes, knowledge and compliance. When we look at the relationship between nurse characteristics and compliance, what we found was that older nurses and non-Hispanic Black nurses and nurses who'd had some additional infection control education reported higher compliance with infection control practices. And we also found that if nurses had more positive attitudes towards infection control, then they also had higher self-reported infection control compliance. So it does appear that there are some interactions between the individual characteristics of nurses and their attitudes towards infection control, and whether or not they self-report behaviours which would be considered to be good infection control practices. As I said, in addition, we carried out a big observation and interview study of actual practices in the home care agency. And the other element of data I wanted to present today was some of the results of the interviews that we conducted with 50 nurses from the Visiting Nurse Service of New York. And each nurse was interviewed after they'd been observed conducting 8 patient visits. The interviews focused on how they identified patients who might be at higher risk of infection and what strategies they used to try and prevent infection, and really exploring in some detail what the issues and characteristic issues were about infection, identifying infections in home care settings and the things that they could do to try and prevent them. And we used an approach called thematic analysis to identify the key themes from that. Again, just some demographics about the nurses that took part in the study. Again, predominantly female, 90% of the sample were female. Very ethnically diverse, 48% Black or African American and another 18% Asian, which is representative of the workforce in New York City. And again, predominantly educated and experienced set of nurses. The 66% had a bachelor's degree, and on average they'd been working as a nurse for 19 years. I'm going to present 3 key themes from the analysis of the interviews around how nurses assessed a patient's risk of infection, what strategies they use to try and mitigate that risk in a home care setting, and what's the barriers and facilitators they perceive to be to infection control practices and behaviours. And this is really a very broad overview of what is a very detailed data set. And again, I can answer any questions if anyone has them at the end. In terms of assessing risk of infection, quite often the nurses said that it wasn't something that they automatically did when they went into somebody's home, but in the process of collecting information about that person. So while they're assessing them and looking at their health status and looking at why they require home care, what medication they're on, what's wrong with them, they're looking at their skin, they're looking at their wounds. And at the end of that process, they may then say, okay, I think that this person is at a higher risk of infection than somebody else I would see. So it's not something that they automatically do, but it is something that they would do in practice if they felt that combination of information indicated it. In terms of specific things that they felt would put a patient at risk of developing an infection, things like having intravenous drugs, a catheter, that they saw that as being something that would put them at risk. Certainly patients who are elderly, who have underlying health conditions such as diabetes, they saw that as being a risk factor for things like urinary tract infections. But unusually, compared to hospital settings, and I think that this is something that comes out in a lot of the data I'm going to be presenting to you, is actually the unique nature of the home environment. Unlike hospitals, nurses have very little control over the environment that they go in when they go into people's homes. Some of the environmental conditions that they saw were not very great. And they mentioned things like people living very close together, whether or not there was good sanitary practices in the house, if they wash their hands or not. So patients' behaviour and the environment where somebody lived could also be a factor in increasing the risk of infection. In terms of intervention strategies that the nurses used to try and mitigate against infection risk, there wasn't any one thing that they could do that would reduce the risk of infection. So sometimes they talked about things like trying not to put their coat or their bag or their laptop or things on a surface in the patient's home, just in case they would pick up something and transmit it to somebody else. They also discussed a lot of detail a strategy of educating patients about infection and infection prevention and control, which was one of the main ways in which they felt that they could deal with infections. In terms of barriers and facilitators, they really were very aware of the risk of them giving a patient that they're caring for an infection. And also that because of the nature of home care practice, they're autonomous practitioners going into homes, they're not being supervised by anybody, that actually it's their responsibility to make sure that they are not giving infections to other people. So they were very clear about the sorts of strategies they undertook to try and reduce that spread of infection between patients, and also the things that they could do while they were in the patient's home to try and reduce the risk of infection developing. And also, as I've already highlighted, is that they're in somebody's home and they actually don't have any control over that environment. And certainly some of the things that the nurses were reporting in terms of some patients in New York had no access to running water, so there was no facility for the patients to wash their hands. They were in conditions where perhaps there was infestations. Some of the patients that they were seeing had other issues such as hoarding. So there were things that they had no control over in terms of the cleanliness and the sanitary conditions of the homes and what they had to do in order to be able to prevent infection in those instances. So they focused on what they could control, which was education of patients, and rather than trying to control the environment, which they had very little control over. So overall, what's come out of our study? What can we understand about the nature of infection prevention and control in home care community settings for community nurses? Overall, our nurses had self-reported high rates of compliance with infection control practices, and that is very reassuring, I think, to a lot of people, that the nurses that we interviewed really had a very good understanding of the things they needed to do to try and reduce infection spread in these community settings. And those nurses who had more positive attitudes about the risk of infection in home care actually had more self-reported compliance. The results of our interviews highlighted some significant barriers to infection control in a home care environment, and the specific challenges that nurses face when they go into a home environment, which are very different to an acute care or hospital setting in terms of the control they have over being able to influence things such as sanitariness, cleanliness, access to water. So it's something which we are continuing to do work on in terms of trying to help nurses identify patients at risk of high risk of infection, and really how we can develop educational interventions for patients to try and help improve some of the infection control behaviours. Just very quickly, I need to acknowledge the funding for the grant, which was supported by the Agency for Healthcare Research and Quality in the United States. And this is a team endeavour, and the research team, particularly Dr. Shang, who is the principal investigator on the project in the United States, and my colleagues from Columbia, the Visiting Nurse Service, and Dr. Russell, who's at Appalachian State University. And I'm more than happy to answer any questions. I think I've done my 20 minutes.
Oh, that's great. Thank you so much, Dawn, for that presentation. We do have some questions for you. So first up, do you keep in touch with colleagues in New York currently? And what are the issues that they're saying with regards to COVID-19 that may be different to those experienced in the UK?
The answer to that is yes. I actually meet with the research team weekly, so I've been talking to them at depth in length about what's happening in New York, and I think some of the differences are just the scale of the COVID-19 epidemic in New York has really overwhelmed the hospital setting. And I don't know if anybody's seen on the news, but they had to set up temporary hospitals in Central Park. And there's been particular issues about things to do with being able to manage the response. And again, there's issues in differences in the healthcare system, in that they have issues about people actually when they go to hospital because of the insurance issues. A lot of the patients who are contracting COVID are, like here, from slightly poorer socioeconomic areas, and maybe sort of Black and ethnic minorities, and they may not necessarily have health insurance. So that means when they do seek out healthcare, it's possibly at the tail end of the disease. So they have, my impression is that they're getting more acute patients because of that. And we have had some discussion about how they're managing patients when they're discharged to the home environment. And how that's being managed in the agency. And what they're tending to do is to schedule appointments for nurses to go and see those patients at the end of the day, so that they don't have any risk of transmission of COVID to other patients on their list. But apart from that, they're still seeing patients and doing that. But I think my overwhelming impression is that they have suffered the epidemic slightly in a slightly more extreme way than we have here.
Okay, thank you. Really interesting to compare the two systems. Is there specific training in infection prevention control for home care nurses, different to that for nurses in hospital settings? And is it the same in the US and the UK?
So I have to confess that I don't know the UK as well, and if there's any infection control nurses who are watching this, they may well be able to correct me. I mean, there is education on infection prevention and control. But how much of that is covered in community settings, I genuinely don't know. In the US, it's agency-led. So the nurses that we that had done an infection control certificate in our agency, it would have been a home care specific one. But the issues are a lot harder in terms of controlling the environment in a home care setting. But certainly the principles of infection prevention and control are the same across settings in terms of things like good hand hygiene and being aware of infection transmission. Great,
thank you. And what are the challenges of doing research with nurses working in the home care settings?
The challenges that are similar to doing research with any group of healthcare professionals. They are very busy, and research isn't quite rightly sometimes their priority. So it's making sure that you are flexible, that you're understanding of the clinical circumstances that people find themselves in, that you can, you know, I mean, I've found over the years that just making sure that your understanding of the context where somebody is working and making sure that your research and the way that you approach people and the way that you conduct the research doesn't interfere with clinical practice, and that you're sympathetic to clinical practice. And in that way, you can often overcome some of the challenges in terms of people maybe being slightly reluctant to participate in the first place. But certainly there's challenges in carrying out research with frontline clinicians just because of the nature of where they work.
Thank you. What do you think the main challenges will be from the COVID outbreak for infection prevention control in these settings?
I think, I mean, there's some immediate issues to do with personal protective equipment for home care professionals. And I think that in the long term, actually infection prevention and control and how we can try and help control infection in community settings is going to become something which is a much more high priority in terms of the agenda. I mean, the evidence at the moment for how this is conducted in home care settings, so not care homes and not hospitals, but home care, is very sparse. And I can see that actually there's going to be a need to really try and understand how we can manage that more effectively. Because we're going to be living with this disease for a while. So I think the prioritization of it is going to be greater than it perhaps traditionally has been.
Thank you. And finally, one more question. 18% of home care residents being admitted to hospital with infection is a large number. How does this compare to other settings and to people of a similar age without care?
So that's a really hard one to answer, and actually mainly because it depends on the availability of the data. So that particular study was looking at patients who received Medicare who were admitted to hospital for an unplanned admission for any reason, and of those 18% had an infection. And you're right, that's quite high, but how that compares to patients in care homes, which would be the other obvious area, off the top of my head, I'm afraid I can't tell you. I could go away and find out, but I can't tell you off the top of my head. And how that compares to people in the general community who aren't receiving home care, again, that would be a different data set that we'd have to look at. And it varies. I mean, one of the big differences between conducting research in the United States and conducting research in the UK is that in the US, they have these massive data sets of patients who receive Medicare that you can look at a national level. And whilst we do have good GP data here in the UK, sometimes that doesn't have the same coverage. So it's perhaps comparing oranges and pears if we wanted to try and do a UK comparison. But if the person who asked that question would like to email me or contact me, I can have a dialogue with them about that. But off the top of my head, I can't give you the figures.
Okay, great. Thank you so much for your presentation. So we'll carry on to our next presentation. Thank you, Dawn.
Thank you.